Kaylee Cantrell, and my friends Cayenne, Isabel, and Anderson and I are juniors in the Health Science Village at ECS, and we're doing a project over spreading awareness about the Zika virus.
Zika is a flu-like virus that's spread through mosquito bites. Most of the patients who have Zika are asymptomatic, but people who are pregnant can have effects on the baby. Watch this video to find out more about the Zika virus.
Welcome, I'm Gene Thomas with the Wedco District Health Department today, and today we're going to talk a little bit about Zika with the classmates here at Elkhorn Crossing School. I'm a licensed Category 8 pesticide applicator for the Wedco District Health Department. I do most of our fogging for mosquitoes in our area, and these nice ladies have asked me out today to do a little bit of education on mosquitoes and the Zika virus.
Okay, so which mosquito spread Zika most primarily?
The Aedes aegypti mosquito spreads the Zika virus mostly. Naturally, only female mosquitoes bite, and most of these mosquitoes are out between 4 p.m. and dusk every evening.
What about those mosquitoes makes them the specific mosquitoes that spread Zika?
Well, those are the specific mosquitoes that have come from the south, from the Caribbean. What we're wondering right now is, can the Aedes aegypti mosquito transfer the virus over to the Aedes albicans mosquito, which we have a lot of here in Kentucky.
What ways do you see the Zika virus impacting our society in the future?
Well, as we currently know now, it affects pregnant women and their newborns with microcephaly and small heads, but it can also have other adverse health effects on the children in their future.
What do you recommend is the most effective preventative method?
Some of the preventive methods are, number one, dump any standing water containers off your property so mosquitoes can't breed. Wear long sleeves to keep them from biting you. Also wear mosquito repellent when you're out, and that will help keep you safe from these mosquitoes.
Hi there, I am Megan Dorsey, a science teacher here at Elkhorn Crossing School. I am 32 years old and happen to be 32 weeks pregnant right now.
So have you or any of your friends and family ever had any encounters with the Zika virus?
I actually happen to have a close friend in Ohio she actually just had her baby, but in January and February she was still pregnant, and her husband traveled out of the country to the Bahamas and knew that he got bit by a mosquito, and upon coming back, I know that their doctor advised that they refrain or abstain from sexual intercourse just to be safe for a period of time, I believe at least 6 months, just to be extra careful.
Are you familiar with the effects that Zika can have on the fetus?
I am aware. I would not say that I am well versed on it by any means. Just quick news reportings that advise that if encountered with the virus, that some birth defects could happen to the child.
We're good.
Hi, my name is Lisa Baker, and I work at Georgetown Community Hospital with 4 physicians.
How is it spread?
It's spread from mosquito bites. It can be spread sexually, and they're looking into seeing if it is spread by blood transfusions.
And also, what do you recommend a mother and father do to prevent being infected with Zika?
You can wear long sleeves, cover your body up, wear insect repellents, use condoms.
Okay. Given that Zika can be transmitted through male or female, have you taken any precautions to prevent it?
We did. We used a lot of bug spray at all times. Anytime you went outside, a lot of the candles to keep bugs away.
If she's infected with Zika, her baby is at a high risk for getting Guillain-Barré syndrome and microcephaly. Guillain-Barré syndrome is when their nerves and their immune system are damaged, and usually that goes away, but they can have permanent damage, like even paralysis, or muscles that control your breathing can even be affected. Microcephaly is when the baby is born with an abnormally small head, and that can lead to brain defects and cause permanent damage.
Look below for our social medias and share them with your friends and help us spread the word about Zika.